Hey, I'm here with my friend Nancy, and she, like most people, has a little stage fright. So I'm going to lead her through this just to make it easier. But I want her to tell the story primarily because it's her story, number one. It's unique and it's inspiring. So I actually asked Nancy to be in one of my commercials a while back, and she wasn't even a patient at the time. But I'll let her tell the story of how she became a patient, how she had her interest sparked by the symptoms of neuropathy. So just give everyone you're talking to right now an idea of what you saw in the room we were filming the commercial.
I had all kinds of issues at times with my feet and feeling in my legs and pain. And I saw a sign that said symptoms of neuropathy when I was in the office. And I read that and I said, I have every bit of that. So I made an appointment and got an evaluation. And from there, I've started treatment at home and here, and with appliances at home and with supplements. And I'm amazed in the past few months at how much I have regained of relief from these symptoms. It's been amazing.
So what symptoms stands out the most to you?
The numbness and pain.
So I asked Nancy if she would be a silent stand-in for one of my commercials. She noticed the poster in the examination room, and that's what prompted her to ask about getting an appointment for herself. So when it comes to what you tried before, you're saying you didn't try anything really.
Nothing. I just thought I'm getting old and I just got to deal with this, and I'd take a Tylenol and pass it off.
And that's the reason we're doing this. It's not to make people uncomfortable in front of a camera, but it's because, like Nancy, there's a lot of people out there who don't know that there's help, there's natural help, who don't want to be on a drug like gabapentin or Neurontin. So for Nancy's case, it just so happened that I knew she would be a who would present well on camera, and I asked her to come by, and sure enough, she was actually able to get help for herself. What about quality of life? What stands out to you?
That I feel like I have more balance, and I understand what's happening with me, and it's just much, much better.
Was it hard?
No, it wasn't hard. It wasn't hard.
Was it something you had to commit to?
Yes.
Every day?
Every day.
Every day. Every day. You know,
Get in a little routine.
neuropathy, as you well know or may not know, is a progressively degenerative disease process. And you have to put the brakes on. And that's all Nancy had to do. She had to put the brakes on and choose to do it. And out of that, she got benefit. Are you 100%?
No.
What percentage would you say you've increased or improved since beginning?
I've improved 75, 80%. I'd like to be 100, but I'm almost that old, so I don't worry about that.
She's really not almost that old, but she's noticed significant improvement just by applying herself to it. And listen, we don't promise anyone 100%. Not one soul do I promise 100% improvement, because I'm not there myself with my own neuropathy. So, but if you have symptoms that you've been struggling with, like Nancy, and you thought there's no hope, or you've been told there's no hope, just know now that there is hope out there if you will just make the first step by calling, setting up the evaluation, and just seeing what condition you're in so that we know for certain and we're not guessing. That sound fair?
I totally agree. I feel like this is one of the best things I've done toward my physical health at this time.
It was like we talked about when Nancy first came in. We talked about anyone. Well, I said the number one killer. This is sad to say, but number one killer of people over 65 is what? Falls. And it concerns a lot of people. So that's the reason why I tell people, I say, look, if stability is an issue, if you're noticing difficulty walking or having good balance or feeling the floor, scary enough, some people, they come here and they'll say, well, I don't feel real well and I'm not trust myself or have a lot of confidence behind the wheel anymore. That's a big deal too.
I didn't realize how little I was feeling in my feet. I knew they hurt and were numb, but after the evaluation, I was it was unreal. I thought this can't be right, but it was correct. And
Brings a lot more clarity to
yes.
it. Yeah. So fantastic. I'm so proud of Nancy. She's worked hard. She's been consistent, and the reality is she's basically gotten a significant benefit from putting forth that effort. So you can too. Nancy, thank you so much. I'm so proud of what you've achieved here. You did all the heavy lifting. I did not do the heavy lifting. I just pointed you in the right direction.
Thank you so much.
Yeah, you're welcome. Thank you.